everybody and join this conversation. Uh, Justin has made these conversations available to bring people up to date that want to know more about the center. And we have another one later this afternoon with more people joining us. Uh, and it's a time for some brief overviews of what the center is doing, and probably a little difficult sometimes for us to be brief, but we'll try to be brief and then uh, ask questions and give us ideas. Those are really what we really need, and to get acquainted here. So I think instead of me speaking, brief introductions might be helpful because this group, some of us know each other real well, and others of us don't know anybody. So uh, I think I already was introduced to Daniel, so I don't need to be introduced. And Julie knows me very well. She was a key member of the administrative staff, and we traveled to India and so forth. So I'll go to you, Bonnie.
Oh, okay. Well, good morning. And Julia, it's so wonderful to get to see you. It's been a long time. And I look forward to having an opportunity to meet Daniel at some point. But I've been with the center since its inception and over 20 years ago, and on the board and continue to be on the board for the center. Um, I have been to India a number of times and many more times to Kenya. And I've been to Rwanda too. So it really feel strongly about the work of the center and glad to continue to be a part of it. I think I'll stop at that point.
Oh, is
Maybe
this
I
me?
should introduce myself, Justin. I'm Daniel Levy. I'm Justin's cousin. I planned on traveling to Africa with you all this past summer, but I wasn't able to make it. I had some health problems. But I'm very interested in what you all are doing, and so I decided to take up Justin's invitation and join you this morning to hear about the year.
Great.
Mhm.
Well, I'm Chin Tan. I'm originally from Singapore, moved to Denver about 25 years ago now. I started volunteering with the center about 10 years ago, and it's been my lifelong passion, really. Um, I trained as a missionary once upon a time and failed at that, but I've been trying to make up ever since together with my partner, Brad. We've been together for 17 years. We have a home in Singapore, and so it's been an easy springboard to our work in India, where we try to go to every year. Our next trip being in January. Brad?
Yeah, I'm Brad and Julie and Daniel. So nice to meet you. I've heard a lot about both of you, and this is kind of unexpected surprise. I'm really pleased that you're on the call, and I'm going to get to know you a little. I'm a retired Denver businessman. Chin and I, as Chin just said, we've been with the center for about, I guess, almost going on 10 years. Time passes. Um, I've been on the board the better part of that time. And we've traveled, ended up traveling a lot with Don and the center. We've been to both, well, we've been to India fairly regularly and, well, Kenya as well. We've been there a number of times in Rwanda. And as Chin has said, this has been a big part of our lives and a very important part that's given us a lot of satisfaction. Um, and I'll leave it with that. And everybody else knows a lot about you, Julie, and I know quite a bit, but I'll pass this on to you.
Thank you. I am Julie White, and I traveled for the first time to India with Don many, many years ago, maybe 20 years ago. Is that possible?
Mm.
Um, and and have been, I worked with the center as well as um, had a very tiny nonprofit for 10 years called One Mother. Um, and I have kind of been out of sight for a while. And one of my hopes for the coming year is to spend more time with the center and getting to meet people again. And um, organization's not my greatest strength, but talking to people about what the center does is. And so I hope to be able to be helpful. Thank you.
I need
Thank
to
you.
jump in again because I need to talk a little bit more about Julie to give the historical emphasis. Julie's already talked about the one mother, but when Julie first joined the staff, I handed her a box, literally a big box of receipts and records that had not been recorded for over 8 months of donations and all. And she had to organize it. So she began the current organization of our financial records way back when. And that was her, one of her first major accomplishments. So when she says she's not organized, I don't quite think that way. I think of her as a super organizer who took an impossible task and took care of it. And also when we're in India and we're talking about eye care and cataracts, all that
Hmm.
stems from Julie's initial work, getting Bethany Lutheran Church involved and contributing and getting that money to Namakal. And she got the Glucin camps involved, and that's leading off to other projects in India today. So I just want to trace the heritage and the legacy of Julie as our friend Ben Lewis joins us here.
Thank you, Don. Thank you, Julie. It's so nice to meet you. Uh, and great timing, Ben, as we're just making some introductions. Um, I'll let you get settled into the Zoom room and just say a quick word about myself. It's nice to meet you, Julie. It's great to see everybody. I've been the executive director now for just over a year. My first experience with the center was, I believe, 12 years ago, going to one of the breakfasts that the centers put on. And in more recent years, in 2023, I traveled with Don and Bonnie and Chin and Brad and others to Kenya and Rwanda, along with my wife, Carrie. And of course, it was a life-changing experience and one that led to me being invited to join the board and roughly a year ago start as the director. So that's my journey with the center. And we are uh, putting on these donor and friends of the center Zoom calls twice a year to hopefully give people a chance to catch up on some of the work we're doing. So really grateful you all have taken the time to connect. And Ben, we'll let you say a few words of introduction, and we'll get started with the official program.
Can you hear me?
Mhm.
Loud and
Yes.
clear.
Sounds good.
Okay. I had a tough time getting on this morning. I don't know why. I use Zoom a lot, but for some reason I had a tough time. I had to put in a bunch of information. Anyway, Don Messer and I have been friends forever. And so he got me uh, connected probably 10 more years ago. I can't remember, maybe more. So active member at Park Hill United Methodist Church and happy to be a part of the center.
Thank you.
Thank you, Ben.
And do you have some connections in the past work with nonprofits?
Much, Bonnie, yes. I worked for 25 years in for-profit and 25 years in nonprofit. So For about 15 years, I worked with Mile High United Way as the senior fundraiser. Yes.
When we go to the theater downtown with Ben and Barb, uh, I never know anyone in the vast theater, but Ben goes up and down the aisle shaking hands with people. They're always how he knows everybody in Denver.
And I've tried to help Justin make connections as well.
He has done more than try. He has done just that. So really grateful, Ben, for all of your support this year for sure. So we will jump into a quick financial report. These numbers are as of November 1st. But so far this year, we've been able to grant roughly $254,000. And you can see here on the pie chart where those dollars are going. Kenya being the largest recipient country-wise. And I'm happy to share that this isn't really a complete a number at $254,000. We're expecting in the next 4 weeks to actually make another roughly $41,000 in grants by the year's end. So that will put us at, again, roughly $295,000, which historically is the highest number we've given out in an annual year. So really proud of that. Obviously, that happens because of folks like you who are on this call and many others who are supporting our work. The second highest amount we've given, just for historical perspective, would be $283,000, and that was in 2023. So wonderful to see in these most recent years, and certainly this year, that the giving levels are at the highest point of the center's history. And we will have a annual report for 2025 that will most likely be published in March. So those final numbers will be shared here in just a few months. So just a quick snapshot of that things are going well, and these funds are getting out to many needy programs that we support. And we'll transition over to Bonnie, who's going to share a little bit about the work specifically being done this year in Kenya.
Hey, thank you. Well, as you can see, it's a major part of the budget, and we have lots of different programs going on in Kenya. So I'm trying to move through them rather rapidly, but I encourage you to come back and ask me some more questions if you'd like to know more about them. We've had reference to the fact that 12 of us went to Kenya in July, and we had a wonderful time. We had some returnees, Brad and Jim. It's always great to have you with us, and Justin and Carrie were there, and Don and myself, and then we had 6 new people. So it's great to be able to introduce what we're doing in Kenya to others. The biggest program that we have going there is the Gift of Hope, which supports 330 orphans. And by definition, an orphan in Kenya is a person who has lost at least one parent. So they may have a parent who's struggling financially, or they may be living with grandparents. And it's a wonderful program. Each child is allocated $200, and it could be more. That helps with school fees and uniforms and special needs that come up during the year. And we have a social worker who is in charge of the whole program, and that's Glory Gatonga. And interestingly, Glory was one of our orphans, or is one of our orphans, but she was identified as having lots of compassion and skills and got additional education. And so she is now in charge of the program. And when someone sees a child that has a special need, they go to Glory, and Glory's the one who helps sort out how we can be helpful to that particular child. And interestingly enough, this last year, she was awarded the best human rights activist in Meru. So she's continuing to have a role in the whole community, which we're very proud of. Um, Additionally, and we did meet with the children, and you can see here, this is from our trip last summer, the picture that Justin has, that we met with the children. We're very happy to meet with us, and it's really wonderful to see the growth and that they are part of. So next, I would mention another person that we do a lot with is Catherine Matua, and she was the bishop of that area. She is now the head of a Methodist treatment center, and it particularly helps persons who are dealing with addictions to alcohol or other drugs. And she's always seeing something more that could be done. And there was a vacant building sitting next to the one that she has her treatment center in, and she has now got it remodeled so that it can serve to help with health needs, and the center helped with the cost of the remodeling. I think some of our donors particularly stepped up and helped to get it up to so that we were able to visit it this summer, and it looks wonderful. And there's private rooms for counseling and rooms to meet with doctors. And while we were there, they had a health clinic, and you see the people sitting there on their chairs waiting in line to be seen and get medicines or testing or whatever it is that they are needing. But it's wonderful to have that actively going on at this point. We also do medical camps where people come in, or we go to another community, and people will walk for miles to get to those treatment programs. And we have, I think our goal is to have three or four of those medical camps a year. But they're highly appreciated by the people. And again, Catherine helps make that happen. Her salary and the salary of one of the staff are provided by the center. Additionally, one of the things that has become a very popular program with the center is providing homes for persons who do not have homes, often grandmothers. And here you're seeing those homes. I'm not sure if we visited and helped with the dedication of two of those centers, but the center has been responsible for 15 homes being built and provided for families. You can see they're on good, solid foundations. They've got windows, a real roof. They get a water tank. They even get mattresses and blankets. It's a 2-room house, but it's solid and it's safe. You've got doors you can lock. One of the families we visited, the grandmother and the grandchildren were living literally in a little shack with the animals. That's where they were. And so this is an incredible improvement, and we're very pleased to be a part of it. And it's $3,000 a home to build that, and a lot of people see that as a wonderful legacy that they can leave. So it's exciting to be a part of that. Let's see what else. Brad and I worked together on the post-secondary scholars. One of the things I learned early on is that when these young people that start out as one of the orphans we're caring for, they graduate from high school. And amazingly, then they go, well, now what? And that was a real shock to me, because I was ready to just celebrate their graduation. And here they had so many more needs. And so we have started helping provide scholarships for these young people. They have to write an application form, and it's become a more what do we call it, Brad? Definitely more of a process at this point for them to be, and we have more applicants than we have money for. But at this point, we have supported 40 orphans. And this past year, 12 of them graduated from the programs that they were a part of, and another 8 have been taken in. And what, Brad? We have 4, 6 that are waiting for scholarships.
Yes. Uh-huh.
Yeah. So it's an ongoing need, but we're really pleased. These young people want to become nurses, doctors, teachers, and help back to the community. They have a real strong sense of wanting to be a part of the solutions and not the problem. Another program that is very active in Meru is the period poverty program. We've become more sensitive to the fact that young women who do not have sanitary supplies cannot go to school for 5 days at least a month, and so they're not getting an adequate education. And so it's another very popular program that we've been asking people to contribute $25 to help with the supplies for a young woman for a year. And that's happening in Meru, and it's also happening in Mawa. And we tend to have events where the young women come together and are given some basic health education, as well as being handed the supplies, and it's a support group for them. We're also becoming aware that the young men need opportunities to get together and have social support. And we're particularly working with Stanley Gattari in Mawa to be supportive not only to the young women, but to the young men there, some of whom are HIV positive. The final program that I'm going to mention is that we're reaching out in several different ways to the LGBT community, excuse me, and being there, supporting them, being concerned about them. There's a lot of issues this year with the government cutting back on its funds. We had a group that were getting USAID nutritional support, and they've lost that. And so we're now providing nutritional support for 46 individuals, 13 of whom are HIV positive and are dealing with food poverty. And you cannot take HIV medication if you don't on an empty stomach. That's just not a possible thing to do. So I think they find us a good support system, kind of an emotional support system, to say that we care about them and value them and want to see good things for them. So I will stop at this point. If someone has a particular question, I'd be happy to try to answer that.
Bonnie, I have a question.
Yes.
There's so many basic needs. Do we see any support or change in the government there's supporting of activities, or has that changed at all over the years?
Well, that's a good question. Certainly, there needs to be more, lots more. The government, and Don, you're probably better than I am at answering that, but my understanding is that the government has helped with some of the meds, paying for some of them, but how you get those out to the individual people and making it available, and certainly a lot more needs to be done, and our government has just pulled back terribly in helping with that. Don, do you want to add anything to that?
Well, actually, when we were there this summer, it was unbelievable. I know Americans wouldn't understand this, but the citizens of Kenya are not exactly happy with their national government right now. I mean, that wouldn't be anything we'd understand in America. But so there were actually, it was a whole day shutdown in the country the first day we arrived. So there's trouble nationally. Locally, they do get support through their more government, I'd say county and state have been more and working particularly in Meru and probably in Mao. I don't know much about that, but it's a struggle, church and state and nonprofits, and of course the need is so overwhelming at times. And we at the center tend to work with the most marginalized. I mean, uh, they're not only poor, but they're often orphans from HIV parents, or as we talked about LGBTQ. Uh, we've chosen to be, you might say, at the end of the road where the people get lost most. So we probably get the least amount of government support.
And I'll just add one last note. So Ben, when I have check-ins with our program leads, that's one of the questions I'm always asking. So what are you seeing? What are you hearing? What's the latest? And really the answer has been pretty much the same for the last 3 or 4 months, that we're okay at the moment. There's still not from their perspective, an organized response from the county or the government at large. Um, I would say in general, they're feeling that the foot will eventually drop, but there hasn't been at least an appeal to us of, oh my gosh, we don't have access to medicine or treatment or care at this moment. We need help. So I'm unfortunately expecting that's going to change pretty quickly here in 2026. So we're preparing for that.
May I add to that? I just pulled up something from the UNAIDS website, and they do have a country update for Kenya. If you want to look specifically into what they're doing, there's what Don mentioned, the usual high-level coordination and multi-sectoral monitoring, and the plea across the country for policy reform, workforce redeployment, and so on and so forth. But all this is conceptual. The immediate impacts are what, as Justin is saying, the cuts are severe. There is severe service disruption. They've led to the closure of drop-in centers and suspension and scaling down of prevention programs for the key populations. There's reduced drug access. Supply of antiretrovirals are down from 3 month supply to a 1 month supply. There is great human resource strain. Many of the 41,000 workers that were supported by USAID, they're out of a job. Uh, it's just dire.
Huh.
Yeah.
Sad.
Incredibly so. Well, Chin, we'll segue to your report on Rwanda, please.
Thanks, Justin. Well, there were how many? About 12 of us, missing you, Daniel, in Kenya. And this year, well, five of us went on to Rwanda for a 5-day trip. Um, on this slide, I wanted to highlight the work that Jane Goodall had done all through her life. Uh, we're all grateful for her transformative work and lifelong service in conservation, education, and research, not only in Tanzania, but she's revered, highly revered in Rwanda and all of East Africa. But also, I wanted to highlight that she was 91 years old and working all the days until the end. She was on a speaking tour across the nation and she passed on at 91. So our work never ends. So this year's trip to Rwanda, we got to spend time with our co-worker and partner, Reverend Augustin Bahati. He is the leader of this nonprofit, aptly named Inclusive Mission for Health and Hope. Uh, he actually has modeled himself after our revered Donald Massa in championing social justice and minority inclusion, and he has successfully administered projects benefiting the poorest of the poor. Just to mention a couple, one is a hair salon owned and operated by young LGBTQ women and men who have been ostracized by families and kicked out of schools. Another is a program training women who come from rural counties in sewing skills and they return home to teach their neighbors. The multiplier effect from these income generating projects is truly substantial. And I am very happy to see from the financials, the chart that Justin showed earlier, that our disbursements to Rwanda is up to 10% now. It's been slowly increasing. Um, Now, the center in the past has supported clergy families in the Rwandan Methodist Church with income generating projects such as pigs and goats or vegetable gardens. We have also organized workshops on AIDS education and prevention in an effort to counter the deeply entrenched beliefs in superstition and witchcraft, which sadly is still central to so many African concepts of disease causation and etiology. Um, Now back to Augustin. His inclusive mission for health and hope is based in Gisenyi. It's up in the northwest corner of Rwanda, bordering Congo. Now, this is the region, as you may know, has seen intense military conflict and has resulted in a significant number of deaths and large displacement of people. Now, most recently, we have committed funds and fundraising efforts to several new initiatives. One is a coalition involving nonprofits working among the marginalized communities, working specifically to lift up the LGBTQ community. We are currently supporting the education of three young adults working on certificates on commercial driving and computer skills. We are currently raising funds also to provide a total of 100 sheep and goats for 100 families to be distributed to vulnerable families in January. The sustainable food and income source can immediately help these families who are mainly from the rural north and east, where the land is not as fertile, which often sees prolonged droughts. This is on top of providing health insurance for more than 120 families and nutritional support for 320 students, which was provided earlier this year. Education and advocacy remain crucial to our work and inclusive mission. With our support, just a couple of days during World AIDS Day, they were out in full force in rural Mukamira. This is in very agricultural and poor part of the country, but there they were going around with a marketing campaign with banners and bullhorns, getting them out to engage in HIV testing and counseling, directly tackling the stigma and discrimination in these parts, where historically there has been silence and shame. So these are some of the projects that is currently going on in Rwanda, and I only hope that they keep growing. With that, I'd like to pass on to Brad to talk about our work in India.
Thanks, Chin. The center has a fairly has a number of programs in India as well. Actually, it's quite a number. These are based in three cities, Kolkata, Chennai, and Namakkal. And I think maybe I'd like to start with Namakkal because in Namakkal is where the I think the history of the center's work in India really has been focused because of Dr. Samuel, whom I think you all are very, very familiar with. Dr. Sam, of course, started some years ago the Women and Children's Care Center there, the Namaqual Clinic, and that has historically been an HIV clinic. That and also a related clinic that he started up in a rural area called Coley Hills. Right now, well, Dr. Sam has been ill for the last couple of years and retired. And right now, the care center is in the process of transitioning to a community resource center with employees directing clients to services throughout Namaqual. Um, the Coley Hills Center is basically, it has a number of programs, but primarily it's they're teaching women how to um, work. Use it's a sewing it's a sewing school, I guess you would call it. Um, And this is in a transition. We were there last March, and we're going to when we go back in January. I think it's we're going to this is going to be something we really are going to be focusing on. Um, the center also has a number of programs in Chennai. The longtime program there has been with Ambrose Donaraj, whom we call Pastor Donaraj because of his connections with various churches, although he is not actually a minister. Um, he comes from the Dalit class, which is the lowest of the classes in India, and he has just, he is he and his Tamarin Community Development Center, which he has there in Chennai, has really been the place where the poorest of the poor and the most marginalized have been able to go, and it has focused primarily on people who've been infected or affected by HIV/AIDS, and he's has a number of programs there. His longtime program um, has been basically support for um, women and children, nutritional support, but also he's done a lot of work helping them start income generating programs. Quite a number of them have 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 accomplished that with his help. Also, there he has helped the sex worker community. He's done a lot of programs with what we call MSM, men having sex with men. These are men who may or may not be gay. Oftentimes are not and have families, but are forced to make an income through sex work. And again, Pastor Donaraj has been trying to help them with income generating programs so they can get out of the sex trade. Another program there is the Imagine Tutoring Program, which was started by Pam Merrill, and um, which also has led to a lot of scholarships in Chennai. Um, the scholarship part of the program is being phased out for now, but we're continuing to support the tutoring program. Also, I think right now, um, I'd just like to say everybody in Chennai remembers Julie very affectionately for all the work that her One Mother program has done there. And that's one of the programs that was very successful in Chennai and part of the center's effort there. The other city where the center has a number of programs is Kolkata. And this has been historically focused around the orphanage there and um, and the connected hospice, but really the whole orphanage. Oh, I'm jumping ahead too fast. I should just mention very quickly here before I move on to Kolkata. We are the center has started to support a number of new programs in Chennai, and those are really worth mentioning. We as of last year are supporting a trance center there that is really quite impressive in what they're doing. Um, a a a group called the Women's Positive Network, um, which is another very impressive group that is supporting HIV positive women. And starting in January, we're going to be supporting um, a a um, a program for grief counseling, the Minnie R. Frederick Grief Counseling Program, in conjunction with the Elmore Wesley Church there, and that is something we're very excited about, which has a lot of possibility, and we'll be seeing how that is started here in January. Anyway, going on to the Kolkata, and I'm taking too much time, I think. The big program there has been the orphanage, where the center has supported a number of programs. We've built dormitories and dining halls and helped with the computer center and tutoring. And we have scholarships there. And again, a new program there or at least connected with it this year is going to be in with women's sanitary pads and helping what in Kenya we call period poverty. Um, Also, we have a number of scholarships there. I think I may have just mentioned that. And connected, but not part of the orphanage, but um, we're going to be working with the nursing home there, and we're starting um, we're exploring an immersive exchange program with the Southwestern College nursing students there. Also, one last thing I should mention, because often forget to mention this, and I think it gets overlooked. Over the years, the center has done a lot with um, workshops and seminars to basically educate people. And every year, the center has sponsored a number of these. And those have been an important part of the center's work as well in India, in all of those, well, not in Namakal, but certainly in Chennai and Kolkata. Anyway, as I said, the center supports a number of programs in India, um, and that is expanding as well. I think for a period of time we thought that might not be the future, but all of a sudden that's looking quite different. And we're going to this trip we're taking in January, I think, is going to be very interesting. And with that, I will turn this all back to Justin.
Thank
Well,
you,
before
Brad.
you do that, Brad, I'm just curious about the government's view these days. Are they pulling back or are
Yep.
they?
Real problem in India. It's the Hindu nationalist, it's a Hindu nationalist government, and they're making it very difficult for nonprofits. I don't know I think Don would have to speak to this. I don't know if they're pulling back from support, but they're making it difficult for us to do our work there. They may have their own programs supporting the HIV/AIDS population and the poor. I don't know so much about that, but I do know for nonprofits generally, they're making it difficult. Everything from making it hard to get visas to transfer money. It's just becoming increasingly more of a problem.
Yeah, I'll just say there definitely has been an emphasis from our program leads that they're fully aware that they need to do a better job of securing support and funding internally from organizations, individuals, businesses in India to just keep moving forward. So that has been a consistent message since I started a year ago.
Thank you. The Indian government doesn't really like to acknowledge the uh, great depth of poverty that still exists in the country. There's a big gap there. Julie would know from firsthand experience. And so programs that are focused on mission and care and compassion for the poorest of the poor uh, don't get much attention from the highest levels of elite. I don't know if that stems partly from the caste system or not, but and I would just simply add, Julie particularly would know this whole program on grief and work with the church there in southern India has been stimulated by the Glusen camps, particularly Sue Ann, who brought us to the donor and so forth. So I like to weave in past history because that's really the way we grow is from people who've done things and you don't often know the strands of your connections until many years later.
Well, I will wrap up our time together with a few updates, starting just with a couple projects here in the U.S. I'm happy to share that on December 1st, we had a really, I think, meaningful and powerful moment together as in community to recognize World AIDS Day. I'm sure many of you have heard in recent days, the State Department even really forbid employees to promote World AIDS Day, to talk about World AIDS Day. And so this year, certainly a gathering like ours really was a powerful. We had roughly probably 250 people join us at Park Hill United Methodist Church. And one of the things I thought was really special about this year is we had more community partners coming together to make World AIDS Day happen than ever in our history of putting together World AIDS Day. So that included over 20 organizations, health providers like UC Health and It Takes a Village and the Denver Health, on and on to LGBTQ plus organizations, One Colorado, which is an advocacy group. The Center on Colfax is a community center, and then various different faith-based organizations and congregations. And they range from Islamic to Jewish to Baptist to Methodist. It was a really wonderful cornucopia of partners. And that's really been an emphasis I've tried to make in my first year is collaboration, finding ways to connect with the community here in Colorado and, of course, elsewhere. And one example of elsewhere is a partnership we've had for a few years now with the Tucson Interfaith HIV/AIDS Network. And I invite you all to join us in March the 8th, for the annual Red Concert. And those dollars that are raised from the weekend are split between our two organizations. So we obviously focus, as you saw in that pie chart, a lot on global outreach and programs, but we are also strengthening what we're doing here, not only in Colorado, but in other places like Arizona as well. And as we get close to entering a new year, just a couple of updates as far as some of the priorities. One, We have, in the last 9 months, really invested some time and money into grant writing, exploring opportunities that will support projects, big and small, around the globe. One example would be a grant that we've put in for construction of a greenhouse in Rwanda, and that greenhouse would provide jobs for the local LGBTQ plus community, as well as, of course, provide nutrition. Um, and we're entering the grant writing world in a time where the competition could not be more fierce. So, being honest with you all, we have yet to land um, a large grant, but I know that the work that we're putting into this will eventually pay off and benefit hopefully thousands of people. Um, other, you know, Brad brought up um, the grief support program that we're launching in January. We're really excited about this, and it's our hope that we'll be able to replicate that program in multiple communities around India moving forward. So we'll certainly keep you all up to date with that progress. Um, and I'll just mention also, there's a 3-year strategic plan that I've been working on and have presented to the board, and that essentially launches our our game planning and direction in 2026. So there's been a lot of thought that's put into that, and we welcome, of course, all of your voices and perspective, and just so know that there are many opportunities beyond writing a check. If you'd like to, join a committee, join some of these conversations that we're having on a regular basis moving forward. And speaking of a new year in 2026, next year is an exciting year for the center. It was 20 years ago in January that the center officially became a 501c3. And so we're going to take this year to celebrate that and the legacy of the organization. So mark your calendars for September 17th. We're going to have a celebration that will celebrate the cultures of these beautiful countries we work in, celebrate the legacy of the work of the center, and of course, get excited for many years to come. So much more on that will be coming in the future months, but looking forward to really taking a moment to celebrate the center and all of the great work that's been done for the last 20 plus years. Um, and so I know we're wrapping up here, but I do want just to take a brief second to answer any questions. Share feedback. Please ask away.
I'm interested in how does the center raise monies, and how do you go about asking the community for assistance and help?
Historically, we have had 3 or 4 signature events, Daniel, that populate the calendar. A spring brunch that really focuses on the Gift of Hope program, the 330 children that we support. A fall breakfast that supports post-secondary scholars. We have a golf tournament in the summer that focuses on a lot of our programs in India. So it's been events. It's been creating collaboration with faith-based organizations. As an example, this year we have 3 churches in the Denver metro area who are doing some fundraising specifically for some of the projects that we mentioned. We set up these giving trees where there's ornaments on the tree that represent different projects that people can buy and buy in memory or in honor of a loved one. Um, so it's a little bit of everything, but it's certainly event driven and of course just connection with individuals. And that's essentially it. Don, do you want to add anything to that?
Uh, well, those are pretty much the key, but individual donations are the primary way. We're not opposed to government grants. We just never had any. So with government cutbacks, we have not lost any because we didn't have any. So and and legacy giving is something that's been, uh, people who put the center in their will. And people just come up with special gifts at times in honor of somebody's birthday or some special event in their life. They surprise us with gifts.
It's cool.
You have any ideas, Daniel? We welcome.
Well, you see, I'm new to a lot of this. I'm very interested in what you're doing, and especially in light of what's happening politically, throughout the U.S., the world today. Um, the more the people can step in and really make the difference, it's crucial. It's crucial.
Well, I would just add on to
Uh,
what you're saying, Daniel, that I think part of our responsibility is to share stories about what we're doing, what's happening, and how they could be involved. Um, and I'll go back to the houses as an example of that. Just
right.
sharing with people that, oh, for $3,000 you could build a house for a family, and people come up with it. Well, part of our responsibility is giving them a vision of what they can do.
Sure, sure. Good.
When you mentioned that, Bonnie, I wrote a little note just because I thought that was such a great tool, like a really good concrete way of making a big impact. And I thought that's a great program.
Thank you.
I like that. And how did the Evergreen Fair? I read in a newsletter, I think, that you guys had set up a table at the Evergreen Alternative Fair. I was just wondering how that worked out.
Yeah, Julie, it went really well. We had a table up at, I believe it was Evergreen Lutheran Church, a really wonderful collaboration. Five five churches and synagogues got together in Evergreen to put on this alternative gift fair with 100% of the proceeds going back to all the nonprofits that were selling their wares. And so we brought back from Kenya this summer some beautiful bags and skirts that were made by our friend Stanley and his team. Many of the items were actually sewed by young women who had lost a parent or two to AIDS. So we were able to sell product, sell actually some of these ornaments that I mentioned. I think we raised gross about $900 from the fair. And in my mind, Julie, it was also such a, perhaps most importantly, just a way for us to connect our mission and what we're doing with many people who had never heard of the center. So that has been and will continue to be a focus of just getting our work and getting a chance to talk to people many times for the first time
Yeah.
at events like that.
Okay. Yeah. One mother used to sell every November, beginning of November there. And it was really a successful place. You get a big audience and a lot of people who really want to buy some product. I think I remember somebody who helped me once with a sale saying, I don't want to sound like a drug dealer here, but we really move some product. So,
Yeah, it
okay.
was a really wonderful weekend. Yeah.
Oh, that's
Thank you
great
for
to hear.
asking. Yeah.
Yeah, and the grief counseling, real quick, is it a long story how the Glusen camps were involved with that? Is their daughter also?
Uh, I don't believe the daughter is directly involved, but
Okay.
Sue Ann met a woman living in Denver who's of Indian heritage and a medical doctor at her local Lutheran church. And the Sue Ann is very interested in grief counseling, and she helped the mother, helped this Indian woman get some grief counseling after her sister died suddenly in Chennai. And as a result, they approached me last March and said, is there something we can do in India? Because the woman from India said they they don't really do grief counseling. They just say, suck it up, you know, you're tough, you
Hmm.
deal with this grief. And so this is evolved in the year. And uh, so uh, a program on grief support, probably maybe even more than counseling, has been developed. A fund, this Indian doctor who was related to the Lutheran Church here in Denver has funded it. Um, and now the widow, the woman who died in India, her daughter is in the U.S. or has been and is interested in continuing programs. So it's kind of evolving at this point.
Okay.
But it's it's been good, a new program, and then we've been able to reestablish a relationship with Glusenkamps and Daniel and Ben. Ron Glusenkamp was the senior pastor of Bethany Lutheran Church, a very prominent Lutheran pastor in this city and in the country, and so and was on the board for a period of time. So it's some people who may slip off our radar for a while come back, and they can sometimes come back with a bang. You know, really make a big
Mhm.
difference. So,
That's good.
Great. Thank you.
So, Justin, where do you office these days? In your basement, in the car?
Well, gosh, a little bit everywhere, but home
Yeah,
base for me is our home in Park Hill.
sure.
So
Yeah.
that's where I'm at today. Um, in just a bit, we have a staff meeting that it was originally going to be at one of our staff members' homes, but with the snow, we decided we're gonna do Zoom today. So as you know, Ben, I spend a lot of time outside of the house, connecting, of
Yes.
course, with the many individuals who believe in the work of the center and all that we're doing. But home is the home office.
Good.
Uh,
Good.
So
Hey,
you guys have a
Justin.
December snow happening, huh?
Yeah.
Yeah,
That's
three
pretty good.
inches out there.
and
That's good.
But
remarkably, our first
I'm
snow.
sorry. I'm going to have to leave here in a few minutes, Justin.
Oh, that's okay. I realize we are over. I'm so grateful for everyone's time and interest. Of course, follow up, and we will follow up with you as well with updates. And just know how much your support is appreciated. So, have a good week, everyone. Happy holidays, and we will connect here soon.
Thank you.
Nice to
To
meet
see
you all.
you.
Bye bye, everyone. Take care.
Bye bye.